Okay, I'd like to welcome you to the webinar, Advocacy and Policy Scope of Practice for Nurses and Midwives in Surgical, Obstetric, and Anesthesia Care. I'm getting some feedback thank you, okay. This webinar is sponsored by G4 Alliance, and Smile Train is part of a webinar series, Nurses Lead and Midwives Lead for the 2020 Year of the Nurse Initiative. My name is Rick Hanker. I'm the American Association of Nurse Anesthetists representative for the G4 Alliance Permanent Council and a board member of G4 Alliance. I'm also a board member with Health Volunteers Overseas and a professor at the University of Pittsburgh School of Nursing. Our distinguished panel that has been invited to present today will provide examples of advocacy and implementation of policy regarding the practice of nurses and midwives in Uganda, Nigeria, Cambodia, and other global sites. In May, the theme of the G4 Alliance was the Year of the Nurse. During that meeting, Elizabeth Ero from WHO and David Stewart, representing the International Council of Nursing, emphasized the importance of moving the policy agenda for nurses and midwives forward to reach the goal of universal health care. Although advocacy involves many policy areas related to nursing and midwifery practice, scope of practice is a policy area that has been highlighted to improve access to care, especially during this pandemic. I would like to acknowledge the sponsors of this program, G4 Alliance and Smile Train. G4 Alliance realizes the importance of advocacy for nurses and midwifery practice as we move toward our goal of improving access to surgical, OB, trauma, and anesthesia care. Smile Train, one of the G4 Alliance members, is the world's largest cleft lip and palate organization, and it partners with nurses around the globe, offering education and training opportunities through Safe Nursing Care Saves Lives workshops and American Heart Association training. Smile Train also works with midwives to identify and refer newborns with clefts for surgical care at local Smile Train partners. I'd like to acknowledge the group that has helped put this together, Laura Hummocky from G4 Alliance, Sarah Hamilton also with Smile Train and G4 Alliance, Natalie Sheneman. Our moderator for this session, very excited to introduce our moderator. Sarah Walji is a Canadian registered nurse presently working in an acute mental health setting in Ontario. Sarah is also completing her master's degree in global health with a focus on child brides and mental health. Sarah currently represents Young Nurses Internationally as a board member with the global campaign Nurses Now. Sarah has presented to global audience in Qatar, Singapore, the UK, and the United States. Sarah is also engaged with her local community as a mental health educator. I'd like to welcome our moderator for the session, Sarah Walji.
Thank you, Rick. I do appreciate the lovely introduction, and I'm looking forward to today's session and having all our panelists and lovely discussions as we go forward with today's program. As Rick indicated, my name is Sarah Walji. I am currently a registered nurse in Ontario. My area of focus is mental health, though I do work on the education level and have participated in policy at the national, municipal, and international levels. I currently am the youngest member on the global campaign board, Nursing Now, and one of my areas of interest and foci is youth engagement within the sphere of nursing and nursing politics. With that being said, I've previously run for parliamentary positions, including in our recent federal election as the Member of Parliament. So I am very amped about today's session on involving nurses and midwives within our policy dialogue. That being said, I have an amazing panel, and I look forward to engaging with them today. And just to give them a little bit of a little introduction, I will be going forward with that. So if I can get the next slide, please. Thank you. So my first panelist for today is Comrade Lawal-Aiyedun Olubunmi, though we will be referring to her as Bumi for the rest of today's session. She's an amazing nurse and midwife, has about 20 years of experience as a nurse specialized in pediatric nursing care, and currently serves as the Chief Executive Officer for Spinal Bifida and Hydrocephalus Care Foundation in Nigeria. As a nurse leader, Bumi has focused on innovative ways of expanding pediatric nursing and midwifery education, birth defects, surveillance and registry, and pediatric surgery and nutrition. My next panelist for today, thank you, is Elizabeth Namukombe Ekong. She is a lecturer with the Department of Nursing at the Uganda Christian University and has been with them since July 2013. She's a chairperson with the Uganda Christian University since August 2018 and has served as a nurse and midwife for the past 27 years. And we're looking forward to having her involved with her vast experience and knowledge in regards to our policy dialogues today. Next, please. Thank you. Next is Dr. Pandora Hardtman. Dr. Pandora has gained 23 years of midwifery experience while working in the USA, Caribbean, Southeast Asia, the Middle East, and Africa. In the past, she has worked closely with ministries of health and midwifery associations in forming strategic directives and regulatory processes, alongside providing clinical and pragmatic assistance for the development and implementation of country-level programs. She's the recipient of the FACNM 2018 Distinguished Service Award, and she's known for encouraging midwives to push for change past the perineum. And our last panelist for today is Miss Mila Prak. She's a fantastic and lovely nurse leader in her own regard. She is currently the president of the Cambodian Nurses Association and has completed her master's in nursing science and nursing administration as of 2016. She was previously the healthcare accreditation advisor for the USAID, EQHA, FH1 360, and has been director of Global Child Health Department at the Angkor Hospital for Children. And with that being said, we will jump into today's session, and I will invite my panelists to give themselves a little bit more of an introduction for the audience members that have currently been involved. So, Bumi, if you want to go ahead with yours, tell us about your work, your involvement within policy at your country level. We look forward to hearing each of you guys participate in your own regard, and I'm looking forward to engaging with you all in today's session.
Thank you so much, Sarah. I want to say good morning, good afternoon, good evening, wherever you are joining us from. My name is Comrade Lawal-Aiyedun Olubunmi, and I'm the CEO, Spina, Bifida, and Hydrocephalus Care Foundation, a foundation that was born a couple of years ago out of the passion for children with congenital anomaly. Being a pediatric nurse, I've worked in SCBU for years, seeing mothers and newborn, especially newborn with congenital anomaly, the way they suffer, they have been marginalized, and a lot of stress for them. That actually gave birth to Spina, Bifida, and Hydrocephalus Care Foundation, a foundation that we have used to promote awareness around congenital anomaly, especially neurotube defect. And we are also part of efforts that brought to bear in Nigeria mandatory food fortification, which is a major intervention for Nigerians, you know, in order to prevent, for instance, vitamin A deficiency. We are also working strongly on folic acid fortification, which is another major area for us as a country. So I'm also the nurse lead for Global Initiative for Children Surgery, a platform that has promotes nurses' involvement in quality and evidence-based intervention as regard to surgical supports, anesthesia care, you know, and obstetric care as well. As you know, that most nurses and midwives work in secondary and tertiary facility. But the one that interests us most, as we know in Nigeria, that more than 63% of Nigerians stay at the community, at the grassroots level. So the midwife who work at the primary health care really have a whole lot to do. And that is why we are really engaging at the level of primary health care, being the national or at the state level, in order to promote quality of care for our people, for the majority of masses who live at the level of community. And of course, we've involved in several advocacy that will be talked about during this webinar, and promote especially inclusion of children with congenital anomaly in order to be covered by national healthcare insurance. That we've really worked on through our family support group for children with congenital anomaly. Again, we've worked on several policy and guidelines on nutrition. IYCF will work with organizations like WHO, FHI 360, and state governments, in order to promote exclusive breastfeeding and other interventions that actually save life, and also promote the quality of care for our adolescent children. Globally, adolescent child is being marginalized. So that is just a few brief of me. But before I move on, I just want to pay a tribute to all COVID patients who have lost their life, because I am a survivor. And for that reason, I want to pay a tribute to all our COVID patients who have lost their life. I want to say thank you and with great respect to all survivors. We are warriors and we are not giving up. And I want to say a big thank you to all nurses and midwives at the front care taking care of COVID patients. God bless you, God bless you, and God bless you. Thank you. Over to you, please.
Oh, sorry about that. I was muted. Thank you, Bunmi. I appreciate the lovely introduction. I welcome Elizabeth to come in and say a few words as well in regards to her work. Elizabeth.
Thank you so much, Sarah, and I greet everyone from the different parts of this world that are on this webinar, and I'm delighted to be part of this webinar. I'm Elizabeth Namukombe Ekong, a registered nurse midwife, but having done my Master's of Nursing Science with a focus in nursing education. My works in nursing started as a registered midwife and practice, and had the passion of dealing with mothers and their babies and labor wards in antenatal and postnatal, and I was so passionate. However, I think as life moves on, you tend to look at what next and how do I promote the care. I think my passion to join education was to really realizing that I couldn't do the bedside nursing alone, but with the opportunity to engage with other younger nurses and midwives and colleagues in form of facilitating their learning and teaching and mentoring. It gave me the opportunity to interface with many of the nurses and midwives in our country and elsewhere in this world, and has really given me an opportunity to engage in the different levels of policy development and policy implementation as a nurse, as a midwife. And currently, when I was appointed as the chairperson of Uganda Nurse and Midwives Council, I think it was an opportunity to see how to move most of the challenges that impact on nursing and midwifery practice and education in terms of policy development and engagements at the different levels. Currently, we are working at developing our scope of practice, you can't believe, and it has been a journey that we have engaged in, and as we share more, I think it has enlightened us to know who should do what and at what level and what kind of public cadres of nurses do we need in our country to be able to strengthen our profession as nurses and midwives to impact the rest of the world. And I really look forward to engaging in the discussion in this webinar, and I look forward to interfacing with colleagues and knowing, forging our way forward on how we can strengthen policy development in our different countries. Thank you.
Thank you for that, Elizabeth. We'll jump right into things with Pandora.
Good day. Small computer glitch there in this technological world. Back with you. Thank you for having me here today, particularly when I think about the time of my career and the involvement in policy work. It's ironic that it was the year I was finishing my training that the American College of Nurse Midwives first began to integrate the concept of the midwife, as a surgical first assist. So it's funny how, now we look and we see how changes in what is happening in the world impact our care. And I think it's only over time as we go through our careers that we begin to see how important kind of the advocacy piece can be for our continuation and helping advance, the cases in our particular of women and mothers in childbirth and everything. It's been pretty interesting, I think, when we look at what's happening within the United States, within the COVID epidemic and the continued expansion of scope of practice. Some of you may be familiar with it, that pretty early in the game of the epidemic, the U.S. Health and Human Services Secretary called really on expansion of scope of practice policy in a lot of states. It was really interesting for us as advanced practice registered nurses. That is kind of the overarching category that CNM, Certified Registered Nurse Anesthetists, nurse practitioners are, because everyone, of course, was pulled into that surge, right? That pandemic surge, because it was almost as if overnight, things that we have been fighting with legislatively for years, writing tons of letters and making lots of calls and doing all sorts of campaigns, restrictions were lifted. So it's amazing to see, expanding practice because we know nurse practitioners, the data's been out for a long time, since the 1960s, kind of when we transitioned into those advanced roles, that we do make an impact from primary care outcomes straight through the maternal health, but things were slow. And even with that, looking at some of the facts as well that we became more familiar with, that we do decrease costs and we do increase client satisfaction and all of those other pieces, the financial pieces that come into, we hate to say it, but the insurance reimbursements and payers out of pockets and all those things that influence scope of practice. So fascinating. I think for those of us that are involved in these realms of care, we're really wondering how this is going to work out. Once we're done with the pandemic surge, will some of these scope of practice limitations be reinstated? How is that going to impact us as nurses and midwives in terms of continued retention to the field, in particular as we look at issues surrounding the aging population, in nursing and midwifery, and the increased burnout, and all of that stuff has happened. So I will say we're a little bit concerned because, once the restrictions are lifted, to then think about going back. And as myself, I can see it sort of when we're working in the theater, just this weekend on call, everything was pulled to bear as I was able to continue with my patient, when she had to have an operative delivery after many hours of not progressing to bring the baby. And I thought, wow, we've come kind of full circle, because as her midwife, she had only ever seen me. So, imagine if we had still had restrictions that disallowed her to continue with the only face. I was the only face in the theater that she actually knew. So as much as it's a challenge, I think one thing I've learned career-wise is that we really have to keep pushing beyond the bar to look at the bigger picture when it comes to moms and babies and what we can do to really impact the full scope of care during this time. So much to say, many stories to share.
Thanks, Pandora. I appreciate it. You've already sparked a bit of today's discussion, so we'll touch on basically everything you kind of alluded to, but I appreciate the lovely introduction for today. And last but not least, our final panelist, Manila. If I can please have you come forward and just give us a brief introduction about yourself. Thank you.
Hello, good morning, everyone. Good afternoon and good evening. This is nighttime in Cambodia. This is 10 p.m. And first of all, I would like to say thank you to the G4 Alliance and the fantastic team for having me here today. And would like to sending love to all nurses and midwives around the world, especially the one who joined the webinar today. I am Manila Prak and I am the president of Cambodian Association of Nurses. I am actually one of the pioneer to establish this association. You may know Cambodia is a small country, and the autonomy of nursing and midwifery is still limited. And then, however, we try hard, and we was trying since 2013 to establish the association, and it took us 6 years to come along the way, and we face a lot of challenge with politicians, with the other disciplinary to overcome this success. So finally we got the association registered with the Ministry of Interior in 2019. And I work for the association for all my volunteer time. This is no paid job. However, I am currently as the healthcare accreditation advisor of the USAID enhancing quality activity through FHI's 300 organization in Cambodia. So this is my role in this organization, also involved a lot with policy development, standard development, and guideline development. So another exciting job to moving, and this is a new job I just started. My reason for my job, I was the director of Global Child Health Department at Onco Hospital for Children. I was implement the community health program called Saving Babies Life program. The program focused on neonate, focused on improving the mortality rate and morbidity rate of neonate in Cambodia. So the mortality rate of neonate in Cambodia quite high, and we was selected one of the very rural province to implement this, because actually the mortality rate of neonate in Cambodia is 18 per 1,000 live birth. However, in the province that we implement the program is 25 per 1,000 live birth. So when I left the program was running very well. It just implement in the system that we already established, and hand over my job to the successor, and it's still running very well. And part of the scope of practice and standard for nursing, actually I have been involved with the Cambodian Ministry of Health and a lot of health partners in Cambodia to establish the nursing process framework, nursing and midwifery protocol, the code of ethics for nurses, the scope of practice and standard of care for nurses, the continuing professional development for nurses. It was a very challenging job, but we were lucky having Professor Richard Henker with us all the time. So I always count on him whenever I face with difficult issues. Sometimes we have to go around rather than go direct. We have to go around to make the politician agree with us. So yeah, it's quite hard job, but it is
quite the process. Yeah. Thank you.
So I'm got used to it going around, not direct.
Definitely.
Okay. Yeah,
and
I look forward to the discussion.
I'm sure you'll be able to bring those experiences forward as we continue through our conversations today. So I really appreciate it. I'm looking forward to engaging with you all today. It's a fantastically expert panel. I'm happy to be a part of this. You are hugely inspirational in your own rights, because you're all nursing and midwifery leaders, and that's something that's really, really important in today's environment, and we're looking forward to seeing how that applies to the policy conversations, how that applies to today's context, especially pertaining to COVID, but we'll get into that later in today's discussion. So I'd like to start out by talking about what the standards are like in your current place and your current countries, what policies, what are the policies in place for the scope of practices that you currently hold? Are nurses and midwives aware of these standards and the practices that they have? And how are those practices shared with nursing and midwifery? How well are they used on the ground? Does anybody want to get our conversation started? I know that Pandora was mentioning quite a little bit in regards to scope. If she wants to pick up from a little bit of the introduction points in regards to that.
Great, hello. Yes, what I tend to find is that in general, the CNM is pretty aware of the scope of practice issues within the states. I think that is in part because of the extensive credentialing processes that you have to go through, particularly if you are hospital-based. It's a ton of paperwork in several months. And so you really have to be really aware of the delineation of where you're at and what you're going to be allowed to do, because that can differ from site to site and from state to state as well. Even though there is the overarching, there are some states that are a little bit more restrictive in things such as prescription policy, prescriptive authority, and the difference in whether you have to have a written collaborative agreement with the physicians that you're in or a supervising physician. So because of that, I think there's a heightened awareness, you know, even as if I working in Georgia versus if I went to work in Michigan, you know, I don't want to get in trouble. That happened to me once before, you know, working in the Caribbean as well, when I did something that I had automatically do in America. And it was like, ooh, that was very early in my career. I remember I ruptured membranes. Whoops, got in big trouble because that was not something that was allowed under the scope of practice there. So yeah, there's a pretty good awareness of how it's used and continued levels of engagement. And it's one of the priorities, I think, at national level as well when we look at this for all sorts of midwives.
Does that carry forward within the Nigerian context as well? Bunmi, can you maybe articulate a little bit in regards to that?
Okay, thank you very much. That is a very beautiful question, because whatever we do as a nurse midwife, we are bounded by policy. And again, in Nigeria as a country of more than 20 million people, we have what we call Nursing and Midwifery Council of Nigeria. We actually call them the council. So the council actually have the statutory responsibility to bring up policy that guide the scope of nursing practice. For instance, in Nigeria, we have nursing practice a policy that produces a standard of practice for nurses and midwives at the primary healthcare level, secondary, that is the general hospital secondary level, and tertiary, because trust me, what a midwife is allowed to do at the primary healthcare level, when you get to tertiary, might not be able to do that. So, but the Nursing Council produced that policy, you know, to guide our scope of practice. We also have a policy around education reform. You know, in Nigeria, we have the School of Nursing, we have the School of Midwifery. But again, now we have skeleton. So we now have colleges, College of Nursing and Midwifery, that is more higher than what we used to have. And right now, there is a proposal by the Nursing and Midwifery Council that says in the next 5 years, all the colleges must be merged to the university. So which means that the School of Nursing and the Midwifery will be soon scraped off. Then we have another policy that is called MCPDP. The MCPDP is also a policy, it's actually the Mandatory Continued Professional Development Program. this is mandatory for all nurses to undergo, especially if you want to renew your license. Again, this is done to bring to bear the policy around the scope of practice so that nurses and midwives and other specialties, you know, in nursing for Nigeria, we have different area of specialty. Like now I'm a midwife, I'm also a nurse. I'm also a pediatric nurse, a pediatric nurse. So in Nigeria, we have programs, education that covers specialty, because as a midwife, there are things that I might not be able to do because I'm not a pediatric nurse. But now I'm a pediatric nurse. So I have better advantage to save life of the newborn, of the infant, of the adolescent, like that. So we have psychiatric nurses, we have, you know, our tutors, we have emergency and accident emergency nurses. So we have different category of nurses and their specialty. So for Nigeria, we have a very robust policy when it comes to nursing and midwifery, and is being guided by the council under the leadership of Federal Ministry of Health. But I also want to say that some of these policies are also very good, well communicated. But you know, when it comes to involvement in policy formulation, we have some limitation, which I am sure during the discussion we're going to discuss some of them. For now, this is a brief. Thank you.
Yeah, I really appreciate the highlight on policy. That's fantastic, because it's going to lead us actually into our next question, and that is, how does policy limit or enable your role? Are there initiatives to change policy around scope of practice? And perhaps we can get some input from Elizabeth in regards to the Ugandan context of that.
Okay, thank you, Sarah, and everyone. And the issue of policy when it comes to Ugandan setting for nurses and midwives, just like you had, working with the Ugandan Nurses and Midwives Council, is a professional regulatory body that actually oversees the training and the practice of nurses in the entire country, both the citizens and non-citizens that come to work within Uganda. And the council, of course, came into place when it was established by the Act of Law of the Parliament of Uganda. And so all that is done by nurses and midwives is being guided by the law of the government of Uganda. So whatever policies are developed in terms of nursing and midwifery have to be embedded within that law so that nurses follow what really was endorsed by Parliament. Of course, I would like to mention that was many years ago, I think, when that law was made and endorsed by Parliament of Uganda in 1996. And we are in the process of reviewing it, because a lot has happened. You'll agree with me, a lot has happened in terms of education, nursing education, midwifery education, and nursing practice. And we realize that the changes in the disease burden, the changes in information and technology that were not there then have to be embedded in this law. So the policies have to be revised to be able to embrace what has taken, the changes that have taken place in terms of healthcare, in terms of nursing education, in terms of practice, and so on. And when it comes to the who makes up probably the council, it is like nurses are represented from the different fora. You know, have presentations from the practice part of it, the association part of it, the education part of it. And all these bring in their issues to be discussed. And after discussing them, then we have to know what kind of policy has to be either developed or has to be revisited or has to be forwarded for discussion and to be passed by the Parliament of Uganda. That is what happened when it came to the scope of practice. Now, what happens, like my colleague in Nigeria mentioned, in Uganda, we have nurses training at different levels. We have those training at certificate level, we have those training at diploma level, and then of course, bachelor's, master's, and then PhD. And when it comes to the scope of practice, these, we look at the practice, there are those general skills that we all gain. Whether you start a diploma, whether you start a certificate or degree, there are those general skills and knowledge that you need to gain and embed in your practice. So when it comes to scope of practice, we have the general that we need, the skills that we need. Then we move into the specialty skills. What is happening right now, by the time we're developing the policy for scope of practice, is that probably we did not have many specialty areas, but I would like to say that the process of developing a policy and having it passed by the parliament is so rigorous, and it requires a lot of steps and stages, moving in and out, just like you may know, you have to identify the issues that may be surrounding the practice or the education or the research. And when you identify the issues, they have to be discussed. You have to review existing policies to know where does it really fall and where shall we push it through. So having realized that we were lacking a policy on the scope of practice, and it was causing a lot of issues in terms of task shifting, that many times our nurses would engage in some of the practices that probably were beyond their expected expectation, and the employer would be ready to use you, definitely, if you do not have the scope, if you do not really share, this is my demarcation. They will even bring in the skills to train you, but probably when you look at your curriculum, that wasn't in your curriculum, and anything go wrong, you can be implicated. And so we realized that some of our nurses and midwives were ending up into courts of law because of some of the things that they had done for the good of the client, but weren't in their scope. And so we are working on having the scope developed and passed by Parliament so that it can be enforced and can be followed. And with time, it can be viewed to embrace whatever new issues that come up in nursing and midwifery as professions. And I would like, I think, to leave it at that, but it is a rigorous process of policy development. And we would like to hear probably what others have engaged in and how easy it has been, how those policies developed and passed. But when it comes to Uganda, it is really, really a process that we all have to learn and engage in and have it done very well. Thank you.
Thank you. At this point, Manila, if you have any additional words to this from Cambodia, what does it look like over there, and to what extent are nurses and midwives actively engaged in this policy process? And are they, if at that?
Well, talking about policy development or policy involvement to Cambodian nurses, I don't think many nurses like it. So it's quite challenging to get the nurses, from the beginning of the development of the nursing standard and scope of practice for nurses in 2014. Because of the educational background of Cambodian nurses still limited, so far we have only 13 master degree nurses. Recently, this is the statistic by 2020, and we have more than 160 bachelor nurses come from abroad, and the total of the nurses in Cambodia is about 11,000. So it's not many nurses, and we have population is 16 million. So the nurses work very hard at the front line, and they are not have a lot of opportunity to involve with policy development. And then when the Cambodian Nursing Council, the Cambodian Nursing Council was established by the royal decree, and the Cambodian Nursing Council invited to join ASEAN meeting, and they always come back with the new tasks and new projects. So I remember at the beginning of 2014, the former president of the Nursing Council come back and asking, we need to develop the scope of practice and standard of care for Cambodian nurses. And then we got to discuss. I at that time was the consultant of the Nursing Council. And then we have to look for the expert. We have to look for someone who have experience and background in develop the scope of practice and standard, because at that time I know nothing about the scope of practice and standard of care. But however, we have Professor Richard Henker. He always volunteer at Onco Hospital for Children, always refer to every year start in 2006. So we approach him, and finally we come up to the agreement of develop the scope of practice and standard of care for Cambodian nurse under the support of World Health Organization and GIC at that time. However, it turned out to be exciting because from the beginning, not many nurses want to involve, but we start to involve them with the grassroots discussion. So we invite them from many different fields, like some come from the Ministry of Health, come from the academic field, come from health center and hospital, public and organization hospital, NGO hospital. And in Cambodia, the education degree, we have 1 year program we call primary nurse. So primary nurse is not referred to the primary nursing follow the American model. This is a nurse who study 1 year. And then we have associate degree the nurse who study 3 years, and then bachelor. At that time, we didn't think about master degree. So we start to develop the scope based on this 3 level of nurses. So we have, we develop like a minimum standard, have 14 standard, and then divide to the 3 scope, like the nurse study for a year, 3 years, and then 4 years. The grassroots discussion actually give us a lot of input because they actually got to be involved discuss actively about their role for the primary nurse, for associate degree nurse, which is study 3 years and then 4 years. So at the end, in 2015, we come up with the standard of care 14 standard, which is the from standard 1 to standard 5, actually the nursing process. Nursing process already used in Cambodia as the framework developed by the Ministry of Health. So it's not difficult to put the nursing process into the new standard. We just add another, what we call professional standard, add into that 5 steps of the nursing process. And then the standard go to the Ministry of Health, and then Ministry of Health submit the standard and the scope of practice to the Ministry of Council. So at that time, the Ministry of Council review the scope of practice and the standard of care, and then provide us the feedback that, the scope of practice is already developed under the Prak of the Ministry of Health. So you should not have another scope of practice. It have to go to another discussion to get to revise that scope of practice. So at that time, with the limitation of time, and then they suggest us to just focus on the standard and not the scope of practice. So we have no choice, and then we remove the scope of practice and then just submit the 14th standard. And at the end, the 14th standard was launched by the Minister of Health at beginning of 2015, and then the scope was published and then sent to all the nurses across the country in the referral hospital. And then now we have, from the support of the USAID, we come up to discuss about the scope again. So we're looking in the existing role and responsibility of the nurses. So we look at that document. The document is not really address the scope of the nursing practice. Actually, the document is address more tasks, like role and responsibility of nurses, but more to task oriented than the holistic approach. So I'm worried that actually this is my worry, that the scope of practice going to be developed or revised on top of that document and not cover the holistic approach and the role of nurses nowadays. However, I am working with the USAID and FHI 360. I am hoping that I would be involved with the revise of the scope of practice.
Oh, that would be awesome, because then we'd have nurses engaged actively within that process, midwives engaged actively within that process. And I think that's something that I've heard a lot on in the global context of things, is that oftentimes we're left out of these discussions surrounding policy, practice versus theory in terms of what our scope's supposed to look like, how that plays out into the practice setting. A lot of that's disconnected because you're having these politician policymakers who aren't actively engaging with the frontline nurses and midwives, and then you're having frontline nurses and midwife experts who are very few and far between, unfortunately, because it's a niche need, in the sense that our training is limited depending on where you got in your training, where you got in your experiences. A lot of that isn't very encouraged in terms of pursuing additional post-grad certifications and credentials, and oftentimes it's very difficult to do so, especially as frontline healthcare providers and frontline clinicians. So I'm hearing a lot of that within each of the country contexts that you all belong to, is that there is quite an interesting conversation that can come out of that. But linking it back to this discussion, for those involved in policy making processes, what has been your experience like thus far? And I guess I'll start with Bumi on this. If you want to give us a couple of insights into your experiences, that would be great.
Okay, thank you once again, Sarah. That is an amazing question. I want to establish the fact that policy for us in Nigeria is actually derived from bills. So who are the people who come up with these bills? Our top politicians, our senators, the House of Rep. So which means that they are expected to look at interest, because we have the Senate in charge of health, the Senate in charge of primary health care. So they look at issues around health within their purview and come up with a bill. So now call critical stakeholders to deliberate on this and contribute. Now, at that level, at times, we are missing. Now, this is what I mean. So recently, the Nigerian Nurses, and that is the National Association of Nigerian Nurses and Midwives, work on a couple of bills that sustain the establishment of primary health care, of cancer registry, and all the likes. But when the Senate, the House of Rep, is actually House of Rep. The House of Rep called for public hearing. We were missing. We were not invited. But not until it takes the proactiveness of the association to get back to them that this is a gross omission. So these are some of my experiences where nurses and midwives are marginalized in policy formulation. Take, for instance, we are in the current of pandemic crisis, pandemic crisis, the COVID-19 crisis. Hardly will you find at the national level, at the state level, nurses involving in the policy or in the planning. So that is, for me, is a disadvantage for nurses. Again, for instance, now in Nigeria, at the level of the federal government, we do not have a department for nurses. So there's no department of nursing and midwifery at the federal level. This is an abnormal. So which means that any policy formulation, we are going to be excluded. Because when it comes to policy as driven by the federal government or Ministry of Health, we expect the Minister of Health, the Permanent Secretary, and the Director of different departments or all the departments. But because the Department of Nursing is subsumed under the Department of Hospital Services, we will not be invited. So that has been my experience, and it's a burning issue for me, that at the national level, the nurses do not have a department. So which means that policy-wise, we are going to be shortchanged most time. And I want to say quickly from my experience that too many few national leadership positions in health are not held by nurses and midwives. We have in Nigeria 36 states. So which means that Nigeria is divided into 6 geopolitical zones. But when you put the state together, we are 36, including the federal capital where I reside. So most of these states have their commissioner of health. Majority are not nurses. We just have 1 or 2 out of 36 that are nursing. So this anomaly, I call it anomaly because that is how I view it, change the relevancy, the contribution, the impact of the nurses and midwives in this country. And I also want to say that the issue of tax shifting, tax sharing, for us in Nigeria, some of very good portion of our activities were tax shifted to a lower healthcare professionals. But none of the tax from our colleagues who have probably commensurate with us or higher than us were tax shifted to us. So it does not really commensurate with what our capacity, what we can do, our level of exposure and specialties. So these are some of my observations that really, really affect the impact and the contribution of nurses when it comes to policy in my country, Nigeria. And I also want to say that that's what we call National Council on Health. National Council on Health is the highest council of health in Nigeria. And trust me, just few nurses have qualified to attend that meetings. Again, which means that if there are policy to be driven, if there are initiatives to be driven, nurses are not there. If you are just one voice, 2 voices in thousands of voices, what can you do? What impact can you make? You can always be marginalized. So most of the time, we are marginalized because we have not been given the opportunity to occupy those positions that will empower us as nurses leaders in this country as a nation. But trust me, the game is changing, the narrative is changing. Because some of us are fighting very hard. Some of us, people like me, aspire that one day I'm going to be Minister of Health. And I know it will happen one day. So you see some of us, the young nurses, and some of our leaders in the Ministry of Health, engaging the critical stakeholder. You know what I mean when I say critical stakeholder? In order to see that, because we cannot fold our hands anymore. 2020 is the year of the nurses and midwives, and we must take advantage of that. We cannot sit down, we cannot keep quiet anymore. So we must take our rightful position. Our position is on the table, taking decisions. We are tired of being kept in the menu, and we've been eaten by so many people. So I just want to say that my experience when it comes to policy is not really too good because we are marginalized. Nurses and midwives are most often marginalized.
There's a need for us to be involved further at that level, and I guess this is what today's conversation is all about. And in the current context of the global pandemic with COVID-19, do we find that that's kind of opened up our scope and our ability to engage with nurses and policymakers and midwifery in that conversation? Are we finding that there has been doors that have been opened up as a result of the COVID-19 pandemic? And perhaps we can jump into a different geographical context, maybe looking at the States with Pandora.
Yes, I would definitely say that the scope has opened up, and some of the issues that have been raised. I've worked on scopes of practice issues in 4 other countries as well, in addition to multiple states here. And I think it's the same, it's opened up. I think part of the challenge too is that nurses and midwives are often waiting to be asked to the table. And so it has to do also, I think, policy shift with attitudinal shift. Don't wait to be asked to the table to kind of insert yourself there, because people don't know what they don't know in terms of who the influences are necessarily. And, you know, I can remember testifying before the National Council of Black State Legislators, like on some what I thought were like very basic issues. And the entire room was like, huh, what? Who, where? But again, inserting yourself. I say that to say, because I was invited to one meeting and then I just kind of made some friends with my fraternity brothers and wound up invited to the entire week. But you have throwing yourself out there because we have a voice, we have a message. But I think this also perhaps can go back to some of our baseline training, because to be honest, it's a different skill set. It's a completely different skill set than the one that is taught at the bedside. You know, when you have to stand up in a room, because, you know, a lot of times the legislative people are men. Hello, standing up in front of 200 men can be vastly intimidating. You know, what do I say? How do I learn to integrate everything that I talk about into nursing and midwifery? We could be talking about the sunshine, and how do I weave that back to what the issues are at hand? So how to dress, how to talk, how to put on some lipstick and high heels, ladies, work what we got. Some may say it's genderized, but I'm a firm believer in using your attributes to make it work. You know, how do you get there and stay there and just learn to make friends? Because, you know, sometimes we can also be so passionate that we're seen as kind of angry about all the stuff that's not working. So it's learning to balance those things as well. One of the things that the US side did do as well was bring in at the national association level someone specifically to always deal with policy issues, so that someone is representing and there with the lobbyists and the lobbying issues, and then multiple people at the state level, and then state level even legislative committees, so that we are constantly diversifying the pool, and, you know, different workshops and conferences that are even dedicated. Forget clinical practice, ladies, let's talk about advocacy. And also the availability. I think that's another thing. A lot of times I've found out invitations come last minute. You don't get a whole lot of advance warning to get invited to the Gold Dome to speak, and you have to be ready to stop, drop, and run. So that's a constant, almost like a trolling of what's the hot button topics that are happening in the news media, right? What's happening now with social media. And a lot of times frontline health workers who are at the bedside, come on, you're changing your shift, right? To change your shift and get time off and swap with somebody, so that, you know, it can be really difficult, which is another, I think, policy level block, you know, that can sometimes happen with that. So we also have to be armed and ready and using all of the allies that we have to speak to what our issues are, every different group.
And you really hit the nail on the head, and I think that that's a great point to leave this conversation out on, because I know that we're just at the peak end of our time here. But thank you. You really brought it into a good summary of all the needs and things that are really lacking within the nursing and midwifery sphere. Unfortunately, we aren't taught basic skills like networking. Attire is huge. How to talk, how to articulate your point, elevator pitches, things like that. And that's all showing you a need as we go forward. And this pandemic, I think, has really broadened our perspectives in terms of what nursing and midwifery is able to achieve. Because look at how many of us have been engaged within dialogues at this present point. Coming to August, where we've been actively involved through the year, we're coming to the tables, we're having conversations, we're building these skills because we're learning that there is such a vast need for that. And in terms of accessibility now, we're not being invited. I'm sure a lot of these conversations are still happening last minute, but it's not to the same extent where, oh, I can't attend because it's three hours away by flight. It's now, oh, okay, it's on a different time zone, but I'm able to maybe swap the shift, maybe get a break here and there, and that opens up a conversation point and awareness piece where we're now able to come and engage in this dialogue and bring it forward. And I'm ecstatic for all the work that all of you are doing. I'm super, super amped that we do have nurse leaders and midwifery leaders like yourselves. And I hope that we continue this conversation as we go forward. And I can only imagine the amount of impact that it's going to have on the global level. So with that, I thank you all for joining us. It's been an amazing conversation with all of you, Manila, Elizabeth, Bumi, Pandora. You guys are fantastic, and I hope that we continue to achieve what we're achieving right now and go forward and beyond. And on that note, I welcome you guys to all engage with us through Twitter, engage in the dialogues online, and thank you again to the G4 and Smile Train for putting this together. It's been a fantastic opportunity and experience.